And welcome back. Emerest Connect offers a dedicated community of home care professionals specializing in holistic wellness. Their cohesive and technology driven remote healthcare collective prioritizes the physical, mental, and emotional health of clients. Here now and joining us is the Emerest Connect's CEO, Josh Klein, and COO, Jack Bernath. And we thank you so much for joining us both.
Oh, it's a pleasure. Thanks for having us. We appreciate it.
Thank
Thank you.
you, thank you. And so, for somebody who may not be so familiar with Emerest Connect, let's walk through a little bit about the work that you're doing and really how you're trying to deal with home care services.
First of all, home care is changing. The population that we're so blessed to serve, there's lots of needs for the underserved communities. And what we truly try to accomplish is to give patients an opportunity to live healthier and happier in their homes by implementing and teaching them ways to keep them healthy, whether it's through technologies and ways forward in order to get good outcomes so they can do well at home.
We hear a lot about the word holistic wellness, and I know that's a word that you tend to use. How do you define holistic wellness from your perspective?
Well, holistic to us is if you, as a home care provider, it's usually mostly clinical. When you hear companies trying to accomplish outcomes, it's usually with doctors, nurses, that which is obviously very, very important, getting access to people to have proper medicine. But to truly address their needs, there has to be, as like we call, like you said, the holistic approach, which is also addressing their social determinants of health, making sure that they have proper food, proper housing. In order for somebody to feel good and feel healthy, you cannot ignore all those factors that is ordinarily not addressed in a doctor's office. So the second we do not address to making sure that we combat loneliness, depression, mental health, and wellness, when that's not doing it holistically. And addressing all those needs truly incorporates everything to get outcomes for the people that, frankly, are underserved and are usually put by the wayside.
Yeah. I want to tackle the topic of telehealth for a minute because I know that's pretty huge these days. Before COVID, but after COVID, certainly, and during COVID, we saw the emergence of telehealth. And so, for your organization, talk to me about how you've been dealing with telehealth and the clients you serve.
I'm glad that you brought up COVID because COVID, necessity is the mother of all invention. And what COVID truly did is operators like Jack and myself, we had a responsibility of thousands of lives throughout the five boroughs in multiple states throughout the country. And when you had so many elderly that we were responsible for, did either not have access to people to come and help them because COVID wouldn't allow them to come in or they didn't want, or elderly patients were afraid to let one in their home. So naturally, we did a risk stratification and said, our responsibility is to make sure that they have access to people to at least to communicate. And when COVID hit day one, we put in thousands of tablets in patients' homes and started having effective communication, just seeing what their needs, besides clinical needs, is to have somebody to talk to. And COVID did that, and lots of companies identified that. But frankly, Jack and I believe that companies stayed stuck. They accomplished a certain amount, but they never chiseled away at truly delivering products than just, as they say, telehealth that most people would know is putting in a device, some peripherals such as taking their blood pressure, monitoring them, but not truly engaging with what those outcomes are. And that's what separates us apart. Is we never stopped at 2020. Everything that we're doing is what we can and we continue to do is perfecting our model as much as possible to get true outcomes and interventions once these alerts come in and arise. So if a patient needs a doctor, we will send that to them, or a patient needs somebody from a social side to talk to because they're lonely and depressed. We intervene and have programs that are tailored to all those needs.
Yeah, let me bring Jack in. And Jack, talk to me about what have you learned, and what have you tried to uh, add to the toolbox, given the fact that COVID did expose a lot of things, particularly the disparities in the healthcare system.
So I'm going to add on to what Josh was saying. When COVID hit, and there was no access to certain things that we added these tablets, and we added so much more in the patient's homes to be able to communicate with them, and Emerest Connect is adding a lot on that, not by just having the typical telehealth engagement with patients, gaming, and communities, and using a lot of those tools going ahead is a lot of what we're doing and keep on doing, helping the population, which are elderly at home and don't go out. And obviously, COVID is, when it was strong, but this is a population which is always where they can't leave their homes and things like that, where we're adding on a lot of different services through technology to making sure that all these stuff is getting done in the homes.
Well, little birdie told me that you got something called remote patient monitoring. So, can you share with me a little bit about remote patient monitoring and how that actually plays into a little bit what we're talking about here?
So remote patient monitoring, typical remote patient monitoring is these tablets and these peripherals, which is being put into the patient's homes, where they're monitoring their blood pressure, their O2 set, a scale for patients which are cardiac patients, diabetic patients are getting other stuff, so which are being monitored. That's the typical remote patient monitoring, where all these numbers come in, and we see what's happening. A lot of these companies, what they would do, go back to and see with doctors, with the PCPs, where it takes them. What we add on to that is, we follow through with a whole lot of different services, where we're making sure that a patient stays at home and doesn't have to wait for 2 weeks of a doctor's appointment to follow up on all of those issues where is arising right there in the home.
Yeah.
What I will add is the intervention. For example, ordinarily where an emergency, when our system, we have 24-hour nurses that are truly engaging with our patients, and if an alert comes in and it warrants the level of an acute emergency, our internal paramedicine system will send somebody to the home and make an assessment. And if it's something that truly needs, if somebody's, for example, having a heart attack and they need a cath lab to make sure that the vessels are open, they're obviously, our ambulance, internal ambulance, will take them. But if there is something, that intervention, if they might just need as simple as fluids or a medication adjustment, we will do that in order to avoid that unnecessary hospitalization.
Yeah. One of the things we talk about is hospitalization rates. Talk to me about how this is actually dealt with the hospitalization rate.
We've successfully, for the highest utilizers of certain payers in New York State, we've reduced their hospitalization by more than 25%. There's lots of reasons, lots of factors why patients end up in the hospital. Sometimes patients are just, frankly,
Lonely at home.
they're lonely at home, and when something bothers them, the initial
911
knee-jerk
is
reaction, or a family member will be on the phone. Their mom lives right here in the Bronx. They live in Nebraska, and the mom is like, "Oh, I'm not feeling well." Their knee-jerk reaction is to call 911. And because we have so many things, that we have most of the tools that an emergency room would have. So if somebody, for example, needs an X-ray because they're coughing, and we want to make sure that they don't have something like pneumonia, we will send X-ray to the patient's home. If they need certain blood work, so we can do almost anything. It's almost like in a hospital at home setting, and to do everything to avoid hospitalization. As you know, the highest utilizing cost in the healthcare system is a patient ending up in a hospital. So any intervention which we have in our network that can to avoid a hospitalization, as I say, we have that in our toolbox.
Yeah, Jack, talk to me, because when we talk about having avoiding these hospitalizations and things like that, one of the ways is about connection and really staying connected, and whether that's with a family person or with other persons as well. But give me a little bit about the social connection component, because I think that's something that you're working to do is really improve that as well.
Right. So as Josh started talking about, a lot of these patients, when they're isolated, they're home, they're bored, or they have any kind of other mental problems, 911 would be the first to think, oh, I'm having a problem, and going and holding them. And as soon as the 911 would enter the home, this patient is being taken to the hospital. What we're doing with all this Emerest Connect, with this technology, this gaming we're doing, and all these interactions we're doing with patients through these devices we're having in a patient's home, that keeps them engaged, that keeps them busy, keeps them happy, and keeps them out of all those troubles. They're making their own communities between the elderly. They're enjoying. They're having a good time. They're waiting to start those programs we're having in the morning. When we start these programs, a lot of them, we don't have to wait for them. They're waiting for us for the program to start. It's an amazing, amazing tools, which we're seeing the patients are engaging a lot, and they're waiting for these kind of programs. And we're seeing, these numbers. What we're seeing is on the social side as well as on the clinical side, that those patients are not ending up in the hospital so much, and we are avoiding hospitalizations just simple by doing all these different things.
Yeah, I know we were talking in the last segment about disparities, and but one of the things that happens in the health industry is there are some health disparities. What are you doing in the area of looking at these health disparities and also being able to address and tackle that?
As we're both sitting in our own television studio. That is a unique television studio. It's a little bit different from what you're on, which is behind us are these monitor walls on both sides, which gives programming to the elderly. And this is housed right here in the Bronx. And Jack and myself wanted it right here. We could have gone in lots of different areas where, Studio City could have been. And we wanted to make a statement and invest in an area such as the Bronx, where there usually isn't ordinarily these tech-driven companies, is bringing in, ushering in, and making access. The first opportunity that Jack and I had to do home care was right here in the Bronx. Never forgetting and understanding that so many don't have access to healthcare. They're unfortunately not eating healthy. To truly understand who are the people that need it most. Chasing the dollars is not what's going to help you build a good company. Understanding the population, caring for the underserved, making sure that that's a priority. There are thousands of patients that Jack and I are blessed to serve, for them to be. And we're very, very, very proud of that fact, is to make sure that, especially the underserved, and we don't just say it, we practice what we preach. Right here in the Bronx, in this building, just to give you an idea, is you, on the previous segment you were talking about the job market. Jack and I are two operators that have invested, most probably more than any sector period, for people that have low income jobs. Have made sure that, besides that we fight for them, but that's just a fight, but put our money where our mouth is, paying them more, advocating to help them pay more. We have right here in our building a 5-star salon that offer caregivers. They can get their hair, nails done, manicures, pedicures. It's a beautiful lounge for them, understanding this population that usually ordinarily doesn't get these type of services. The big tech companies are very used to having all these fancy perks, but the people that are delivering the care in these homes are usually, they in our mind, underpaid, undervalued. And that is something that Jack and I are always a champion of, and being at the front of all of this. And we're not just saying it, we're investing in our workforce and doing it right in certain areas where it's not the ritzy titsy. To us, the Bronx is the ritzy titsy.
Yeah, well, the Bronx is the place to be, and obviously, it's home for us, and we know there are a lot of great things that happen here in the borough of the Bronx, and now we're glad to be talking about Emerest Connect and the work that's going on. For people who are caregivers, I think you talked about that as well, that they're very important. I mean, you have patients, but then you also have caregivers. What else is available for a caregiver through Emerest Connect?
So I think, as Josh said, so Emerest Connect is the technology piece more on the patient side. What we have as a company, as you know, we do starting with home care. We have these employees working for us. So this is an add-on, which Josh was just explaining, was the U-Add. U-Add means where they have a salon coming in and having the free. They're getting manicures, pedicures, their hair done, and they have a lounge where they lounge, and we make them feel good about themselves. As Josh said, a lot of these caregivers are not a lot, all of them, they're underpaid and they're having a very hard job. To us, they are the hardest workers. You know, going into a patient, you know, we're doing this for 25 years. We wouldn't be able to be in the patient's home for more than 20 minutes. They are there for hours and hours and hours and working. You know, what we have seen in the past, all these years doing home care, a lot of, you know, we're always afraid. How is the patient? How are these employees to the patients? We as a company, we always make sure how the patient is to the employee. You know, a lot of these employees are getting harassed. So we're doing and working very, very hard on the employee side to have these employees, to give them as much as we can, more than we can, and more than others, to make sure that they are a happy and well taken care of employee. And as Josh said, we have these sites, the UAT sites, which we're doing for our employees, and a lot, and most when where we started with these were in the Bronx. Bronx is a very, very important borough for us.
I just want to add on that. You were saying about their job. To us, they're just as important as a physician. Sometimes, and one of the reasons why we do a lot of these investments in our workforce is a doctor sees a patient. Of course, they're talented and they went to school to identify, but a caregiver that's in a patient's home for a longer period of time can add so much more value, and it's building them. We have lots of programs internally that we want home health aides to grow. Nobody wants to stay stagnant. And if somebody wants to become an LPN, we have these things we want the same way we want to grow as people. These caregivers have the hardest job in the world. They sometimes take two buses, four trains, leave two kids at home with somebody to watch their kids. If we lose sight for 1 second for the well-being of the people that are delivering the care, we're not doing our job.
Yeah. Well, gentlemen, we got to leave it there. Thank you so much for talking and sharing with us. Glad to have you. Glad to know a little bit more about Emerest Connect, and hope to see you soon.
Thank you very
Thank
much.
you very much.
Thank you.
Have a
All
great
righty.
day.
You guys take
Thank
care.
you.